All right, hello Public Health 2. My name is Jonathan Liu, and here's my presentation on a case study regarding folic acid deficiency and neural tube defects. This can be found in Milestones in Public Health, Chapter 8. Step 1, gathering background information. Folic acid deficiency causes neural tube defects, also known as NTDs, with the two most serious being spina bifida and anencephaly. Spina bifida, as shown by the picture in the bottom right, is when a baby is born with an underdeveloped spinal cord, leading to an outward protrusion that is covered by an abnormal tuft of hair. And unfortunately, these babies will live to have paralysis and mental impairment. For the picture on the bottom left, that is anencephaly, where a baby is born with an incomplete brain and skull. This condition is always fatal, and unfortunately, most babies pass away in stillbirth. Step 2, we need to analyze the current situation. 3,000 pregnancies are affected by neural tube disorders every year in the United States, according to a study performed by the CDC in 2017. Performing a SWOT analysis on the situation, a strength of this is that 81 countries around the world have already implemented folic acid fortification, which involves the fortification of grains that ends up turning into our pastas and cereals. A weakness is that a majority of countries in Asia and Europe refuse mandatory fortification, arguing that a good enough diet is enough to prevent folic acid deficiency. An opportunity we have to push this forward is to participate with public health organizations such as the Food Fortification Initiative, which works with countries to improve their national fortification programs. And as a threat, misinformation, poor planning, and public skepticism often undermine the seriousness of folic acid deficiency. Step 3, prioritizing core issues. Despite vigorous campaigning efforts throughout the years, many women still have insufficient folic acid uptake. Countries where folic acid fortification is not required or there's a lack of supplements have an increased rate in neural tube disorders. Bottom line, neural tube disorders are preventable but are difficult and or costly to treat, considering that the average cost of spina bifida treatment is 22,000 years in the first year of an infant's life. As of right now, there are no cures for spina bifida or anencephaly. Step 4, we need to analyze alternatives. The most obvious solution to folic acid deficiency is to mandate folic acid fortification globally and increase access to folic acid supplements. By applying the health belief model and putting ourselves in the position of a planning or pregnant woman, we understand that perceived susceptibility as neural tube disorders do not discriminate. This can happen to anyone if preventative measures are not taken. In terms of perceived severity, neural tube disorders can cause lifelong disabilities in children, limit life expectancy drastically, cause emotional trauma to the parents, and incur large healthcare expenses. In terms of perceived benefits, neural tube defects are preventable as the price of prevention is insignificant compared to the price of treatment. And to promote self-efficacy, women are more likely to be educated on the dangers of folic acid deficiency, will be more likely to maintain high folic acid levels, and consult their gynecologist. Some alternative solutions that have happened in the past involve passing legislation, with the most obvious being that the FDA mandating requiring grain fortification in the United States, implemented in 1991. This reduced the occurrences of neural tube defects by 35%. A study that was done in Turkey involved increasing the awareness of neural tube defects to general medical practitioners. This involved a standardized NTD awareness form where planning families were the target demographic, and they filled out a questionnaire to somewhat inform them on the dangers of neural tube defects and folic acid deficiency. And this provided statistically significant relationships between educational status and the preventions of neural tube disorders, but the questionnaire itself did provide results that were not statistically significant. Step 5, provide recommendations. The CDC recommends at least 400 micrograms of folic acid each day by taking vitamin supplements or having a fortified diet. In addition, do not take medication that interferes with the body's use of folic acid. Lastly, learn about family medical history as pre-existing cases of neural tube disorders in the families increase risk factors. Step 6, we need to establish an action plan. Please note that these timestamps are starting from 2022 onwards. Moving forward, mandatory grain fortification needs to be a global priority. World leaders need to be informed, preferably by 2029, and they must act upon it. Next, I would like to involve government officials who work in the Department of Health to push for a plan for folic acid distribution, similar to the patent of free feminine products, such as tampons and pads, preferably by 2027. Lastly, I would like to ensure that folic acid remains covered by most health insurance companies and or have the over-the-counter price drastically reduced by 2027. Step 7, finalize and add opinion. Overall, folic acid deficiency is less of a problem domestically, but much needs to be done on a global scale. Ultimately, neural tube disorders are preventable. These incidents shouldn't even be considered infrequent, but I understand that it is ideal to completely eradicate the problem. Solutions have been proven to be cost-effective and they work. So I think much can be actually done about this. Thank you. And here are my references to the slides.